premature exposure of another condition called shingles, which is, in my opinion, much more painful and much more detrimental because it's already embedded in the neural system. It's back in what we call the glial cells or the cell bodies of the nervous system. And that's where it hangs out. Okay? Here's an interesting thing. Herpes now, the genital type, they have a wonderful vaccination for. So be promiscuous and get the vaccination and you'll be fine. Is what's promoted on the commercial, right? Now there's Valtrex. I'm 17 and I can be promiscuous and it's great. Well, what about abstinence? What about avoiding being exposed? And what about the fact that every time then that herpes, be it simplex 1 or simplex 2, meaning the cold sore or a genital herpes, it's actually setting back in the central nervous system. And each time that gets activated in the central nervous system, it actually creates pro-inflammatory proteins or alpha-synuclein proteins, which in our article in The Wave had to do with neurodegeneration. So every time that this guy expresses itself, it's actually creating a setup for neurodegenerative disease like Parkinson's disease. Okay? One of the worst cases of Parkinsonism I've seen was actually from a person who had shingles that came out in their cranial nerve, number 5, in the trigeminal division of the ophthalmic branch. It actually was a vesicle that was so large that it actually caused partial blindness, not by affecting the eye nerve, but actually the vesicle was so large that it actually shut the eyelid. This was a huge blister. It was awful. It actually came back up over the skull, and that pile, if you will, of of viral vesiculation or body response to the virus was actually creating inflammation back in the brain. And from there, then that person developed the tremor and the difficult gait and all that goes along with Parkinsonism. Okay? So again, are we actually attenuating the virus or are we actually creating a super virus? How many of you have seen annually advertised flu shots offered here? Okay? $20 flu shots at the grocery market now. Wow, what a deal! You used to have to pay $50 for those. We can get them for $20. And now you actually see flu virus. Why is it then chickenpox seems to be going down, polio seems to be going down, but flu seems to be getting more ugly? H1N1, avian, monkey, whatever flus, right? All swine flu. I forgot the pigs. You can't leave them out. So why is it that the flu vaccine is so ineffective, per se? Okay? Think about it this way. If this virus is nothing more than a naked protein, okay? And inside is this gene, and it comes in and it uses or incorporates my DNA to actually replicate itself. And now it comes out and it has in it not only this viral response, but right on the end now, it actually tagged or took out a little snippet from a virus that used to be active in my system, and now it actually pushed out and took along a tag with it, that piece of DNA from virus that actually confused the human genome. When they mapped out the human genome, they had 70% of the human genome mapped out. 30% of the human genome now is viral DNA. And they were so perplexed by that amount that they couldn't figure out, what is all this DNA? It's actually viral DNA. We're actually replicating and passing on generation after generation. And this brilliant, non-living virus has the ability to go in, capture a portion of that other virus, and now comes out, and the flu vaccine made in Europe a year before the flu even comes to us is now brought to our country, given as an injection, and by the time you have the flu that passed on to you and passed on to you and then goes to your valley and comes back up to my valley, it's not even the same virus that you started with. Okay? No wonder it's so difficult to get rid of. No wonder it's so confusing to the immune system, and no wonder the system becomes more and more confused when it gets other types of injections that only increase a fever response for a moment and against something then that is not even the same existing protein, right? So again, the question, what really are we being vaccinated against, and is it building, is it holding, or is it harming the system, right? So let's come then to the next question when we look at vaccinations and what it is that commonly parents use because they know their child's going to be irritable after getting that shot in the leg. Okay? So, if my first experience with my child at 6 months, at 12 months, when I gave them a vaccination, they got a bad sore leg and they cried for 2 days and pulled at their ears and they were all fevered up. Next time my child has a fever, what am I going to give them before I even give them a vaccine? Tylenol. Exactly. Tylenol has been proven to impair liver function. And in a little person, when we give Tylenol, it doesn't only impair liver function, it actually dumps the glutathione, which is our phase 2 detoxification pathway, which is our neuroprotective barrier. By giving Tylenol before we go and get the immunization, we actually just dumped our body's own natural detox response. And consequently, just dumped brain's #1 protective antioxidant. And just set up the brain for neuroinflammatory, bless you, oh, that's a big one. Big blessings for you. Neuroinflammatory cytokines. Or in other words, we just set the brain up to explode or be completely on fire. Okay? What is a brain on fire? If there's already a potential gene for autoimmune activation, now we see something called autism. Okay? Now we see something expressed as neurodevelopmental disorders. Right? What did we really do? We just created a neuroinflammatory process by dumping liver's ability to protect the amazing brain that is sitting there preciously waiting to learn. And now, all of a sudden, my baby who was talking lost all of his words. Okay? My little baby who was starting to crawl is now just laying flaccid. Now my baby that was ready to start to communicate and grasp and reach out is now starting to be more flaccid. Okay? Because of a neuroinflammatory cytokine cascade, now the brain feels like it's on fire. And that gene, that aberrant gene that wasn't supposed to express, all of a sudden started to express. Okay? So we start to see that crank up. I'll give some examples in just a bit after you go off the camera, okay? And I'll talk to you about all of these things and where we need to look. My question to you again then is, if baby already has neuroinflammation, okay? If baby already has a fever, if baby already has earaches, if baby already has a respiratory infection, is it wise to further challenge the immune system while they're down? It's just a question I want you to think about. Okay? If baby is projectile vomiting, if baby is unable to void its bowels on its own, if baby is cocked with its head to one side, if baby is contracted and getting a flat spot on one side of its head, if we see baby posturing and is stiff, or the muscles actually look like a little bodybuilder, right? Is it best to challenge the immune system further? Just questions, right? If we don't give Tylenol, what can we give that doesn't tank the liver? From a functional perspective, we could give echinacea hydrastis. Okay? Echinacea hydrastis actually will reduce a fever. Okay? Echinacea, I'll just put E. Everybody's familiar with echinacea. Comes in a drop form, very easily delivered. Babies can tolerate it. What else could you use? If you don't like to go this pathway, do not give Tylenol. I'll say it one more time. Do not give a Tylenol to a child before you give them a vaccination. Right? So without reservation, I'm going to say, please do not give Tylenol to a baby before vaccination. Yes, you can give ibuprofen, and yes, you can give Motrin. It doesn't taint the liver. I will say that. That's based off of Dr. Brandon Brock's information in the Carrick Institute. Okay, the studies. You can give those too. I would prefer this. These three are your options. Right? Let me say it one more time. Tylenol should be eliminated from your baby's first aid kit. Let me say it a different way. Take out Tylenol from your first aid kit for your child. I don't know how many other ways I can say it.
And for yourself.
Well, we'll go to the adults later. And for yourself. So that is a key. Pardon?
So they say to take that when you're pregnant too, Tylenol not. Yes.
Yeah. So again, when you are pregnant, because of the impairment of liver, if your brain is already at risk, pregnant mother, this is not an option because it will dump your glutathione levels and you will have neuroinflammation. Your likelihood for postpartum depression increases exponentially. All right? So major key, if you're feeling down, get some glutathione. All right? And start to protect that brain. If your child has neural inflammation, get them on a glutathione recycler, resveratrol, and turmeric. Okay, we have to get them to get that inflammation down fast. The faster we can get that down, the better off we are. Okay, I'll review that tonight before we go, and I'll show you those products that we use. But again, for this discussion, these are the things that we really want to look at. Okay, clear on that? And the why? Yes? Okay. When we look then further at this, and again with baby, look at baby's health, and if you're choosing to use some type of an immunization, choose to offer those when baby is strong enough to actually deal with it. And number two, has enough of an immune system to actually respond and build antibodies against. Again, your choice of hepatitis B, if you really think that that's necessary at birth, and if you think then that you're going to be somewhere where your child's going to be prone to that activity, you may consider that at the appropriate time, and again, be responsible. Okay? There are a lot of books out right now about both sides. My biggest challenge for you tonight is make a decision based off of the maturity and the health of the child. Can it tolerate it? Can you, as the parent, tolerate it? If your child's throwing fits, your child is in its best way trying to communicate with you, I'm not doing well. Please wait. Okay? Please wait. Please just give me a little time. I'd like to be healthy, and I want for you to be healthy. You'll sleep better, and I'll sleep better. Okay? If we can just wait. Now, any other questions before we go to some examples? Okay, go ahead. Turn that off, please.